Welcome to the Dose of Good podcast, where we celebrate good people and organizations working to make the world a better place. It can be easy to get caught up in the bad things going on in the world and forget about the good happening all around us each and every day. I'm your host, Erin, and I want to share these stories with you and give them the attention they deserve. I hope this podcast educates and inspires you and maybe even motivates you to share a dose of good in your community. Now let's get into today's episode. Today's episode is an impactful one. This was not an organization I had previously heard about, but through my Lions Club connections, they reached out to me and let me know about this organization, and I'm so glad that they did. It is called Traveling Tooth Fairies, and it's a couple of dental hygienists who started this organization to help kids in Nashua, New Hampshire to get dental care who might not otherwise get it, and through the schools to improve the overall dental health of children in Nashua. And I speak with Myra Nikitas, who is one of the co-founders of the Traveling Tooth Fairies. And the information she shared was eye-opening and I think important for everybody to hear when it comes to dental health. So let's jump right into the episode with Myra. Today I'm speaking to Myra Nikitas, the co-founder of Traveling Tooth Fairies. Thank you for being here today.
Thank you so much for having me today. This is great.
So what are the Traveling Tooth Fairies and what made you want to start the organization?
So the Traveling Tooth Fairies is a mobile kind of like a mobile dental program. It's founded by two dental hygienists, public health hygienists, myself, my co-founder, Mary Duquette. We put the program together because last year we were involved in a pilot program that was sponsored by the Department of Health and Human Services and Solvair Health, and funding was going to be ending for the year. So the CDC provided funding for just a year for this program to kind of take place in Nashua. And Erin, I'll kind of go back a little bit. So a few years ago, the Department of Health and Human Services conducted like oral assessments specifically for third grade students in the state of New Hampshire. And after that data was collected and kind of reviewed, Nashua had the highest prevalence of untreated dental decay. So that's why initially this program kind of came about last year, and the Department of Health and Human Services, along with the CDC, provided funding for just a year to see how, we could kind of help the community with kind of promoting the program, promoting oral health, and how could we help these kids in need. So when the program had ended last June, I was so sad because I wanted to make sure this program continued. It's been so impactful within the community, and my colleague and I, who's Mary, we put together a 501c3 nonprofit organization. So the Traveling Tooth Fairies is the fiscal agent. It's a nonprofit organization, and Sealing Smiles is the program name that is taking place in the Nashua School District right now.
Okay. And do they know why Nashua had such a prevalence?
No, I don't know, and I wish I knew the answer to that. I mean, you think all, hygienists were deployed throughout the state of New Hampshire, right? So from all the way from Berlin north to all over the state. Yeah. And it was very unfortunate to hear that myself, I live in Nashua. My son, grew up in Nashua, is in school in Nashua, and that we had the highest prevalence of dental caries was like a stab to my heart. I don't know the reasoning for that. I'm just not sure if it's just the community just not knowing, not being educated, maybe not having a provider to go to, maybe. I just don't know. Yeah. Some of these kids that we've treated so far, and one specifically that comes out to me is they share a toothbrush, or so. You never thought Nashua would kind of be number one for that. Yeah. So I wish I knew the answer.
Yeah. I was going to ask you a little about your background. So you said you're a dental hygienist.
Yes.
Did you want to share any more
Yeah,
about that?
sure.
Or
So,
okay.
I've been a hygienist for close to 20 years. I started out in private practice, and from there, I really wanted to give back to the community. I was a member of the board of directors for the Greater Nashua Dental Connection, which is also a nonprofit. When COVID hit, I took a full-time job as their public health hygienist there, and really saw that there was a need in the community, just a profound need, and I wanted to do something that was going to help change, the community. We would see kids at the dental connection and provide care, but it just wasn't enough. These kids were leaving, that facility with treatment plans like a mile long. So I just felt like we need to reach these kids where they're at. We need to help reduce the barriers for kids to access dental care. And one of them, could be transportation, could be providing, cost, could be just a language barrier. So I was really, touched by, being in public health. I was also a past president of the New Hampshire Dental Hygienists Association. I took that on right about when COVID hit. So you can imagine just the fear, especially within our profession, of going back to work with aerosols. I participated in the governor's reopening task force committee, giving some testimonial information about, hygienists and what we felt were our concerns returning back to work. I also served as chair for the Dental Hygienists Committee under the Board of Dental Examiners for the state. So we kind of reviewed policy and some of the laws just to kind of review with the Board of Dental Examiners. And I'm also a dental investigator for the state of New Hampshire. So just passionate in what I do. This is something that I am so grateful to be involved in. And also, I grew up in Londonderry, so I was one of those kids that received care through a school-based program. My parents came from Greece and, just didn't take us to the dentist unless something hurt. And so I received some care through a school-based program similar to the one that I am running now. So I know firsthand how impactful this kind of care is.
Yeah, definitely. Just because you mentioned it, and I'm curious, what does a dental investigator
Oh,
do?
sure. So I review cases that are assigned to me by the Office of Professional Licensure and Certification. Could be quality control, could be malpractice, anything like that. So when a case is assigned to me, it's my job to kind of investigate and provide a report to the Board of Dental Examiners for them to review and see if there's any adjudication or anything that would need to be done.
I know in talking to my own hygienist, there's been a lot done to try to educate people on the importance of oral health, but I feel like there's still a lot of people that maybe don't know the importance. So why is your oral health so important?
Well, it's funny that you mention that because untreated dental disease or dental decay is the number one disease amongst our youth. So it's more prevalent than asthma. It's more prevalent than diabetes. It's the number one reason why a child will miss school. We finally put that connection that the mouth is connected to the body, right? So our oral health can really depict what is going on in our body. We have bleeding gums or continuous, infections. It's a source that there's maybe an underlying condition that's not being diagnosed. Can contribute to diabetes. Your numbers that will, your A1C number that maybe is not coming down because of the disease in your mouth is not stable, can also contribute to heart disease. So there's a lot of different information out there right now. And especially, your mouth is like the gateway to your body, right? So we try to educate a healthy mouth is a healthy body. Just flossing, brushing your teeth every day can really prevent disease and the growth of bacteria. So
that's helpful for people to know, so thank
Yes.
you. How do you go about finding those in need of your services? Is it through the schools, or do you just offer it to anyone in Nashua schools, or?
So it's a very wonderful collaborative effort that we have with the superintendent, support staff, and nurses throughout the Nashua schools. So we visit all the elementary and middle schools. We provide, the consent forms and send home the information. So we kind of coordinate with every school when we'll be visiting. So we drop off the materials, they distribute the materials. There's over like 7,000 students in Nashua. Including, high school students. But last year alone, we screened and treated over 823 kids. This year, we're on our fourth school, and we've already seen and treated over 400 kids. So it's our goal to visit, all the elementary schools and middle schools. There's 17 of them. And to go there actually twice. So we coordinate with the schools to kind of find a date or time, or because we have a setup in a room as well. So we bring our equipment into the school, we set up, and we're usually there for the week. So, we already know the kids that we're going to see because their consent form came back. We reviewed it. We entered it into our computer system, and we kind of put together like a mock schedule. So we give that to, could be like a support staff, the nurse, and they help us kind of coordinate and calling down the students. We don't want to interfere with, any school activities being like lunch or recess. We don't want to interfere with any specialty that the student has. So we'll make sure that we find a time that the student can come to us. It's about an appointment average time, Erin, is about 15 to 20 minutes.
Okay.
So, and these students feel comfortable. They're coming down with their friends. They're coming down with a teacher that they feel comfortable with. A lot of these students that we're seeing are repeat students from last year. So you have to think some of these students maybe haven't seen a dentist or been screened since the last time we were there, which could have been, a year ago.
Yeah.
So it's wonderful, the collaborative efforts with the schools, the superintendents, Dr. Andrade, and the principals, because they really see the value in our program.
That's great that you're able to help these kids get the dental care that they might not otherwise get and possibly prevent issues later on. So that's wonderful. As far as your funding, do you just do fundraisers to try to keep up with that? Can people donate? How does that all work?
Sure. So we were provided funding through Northeast Delta Dental that came through the city of Nashua. So I collaborated with Bobby Bagley, who's this public health director for the city, and we put together a grant that Northeast Delta Dental had funded our program for this year. So along with the Lions Club, they donated some funds in the Department of Health and Human Services. So it's our hope that, we continue to fundraise. We do have a website that we would accept donations. That money that is donated would go towards the care for providing kids with care, or even, if it's something beyond our scope in the schools, to connect them with a provider that will be able to treat them. Maybe they need a tooth out, something that's beyond our scope. So that money is directly allocated to kids' care. So Traveling Tooth Fairies.com is our website. There is a PayPal link there that you can donate. We hope to continue to secure funding for next year. And by doing that, just writing grants and just applying to, to secure the funding. So different grants within the state, that we'll hope to apply again to Northeast Delta. So fingers crossed.
Yes, definitely. Well, I hope that all comes through for you, and
Thank
that
you.
maybe even individuals donate, because it sounds like a great program that I hope will continue.
Thank you so much. Yes. Yeah, we hope with, so our program, with the generosity of the community and grants, is how we are sustained right now.
Sure.
There are services that we can bill out to New Hampshire Medicaid through our program. It's with a CHAP program, but again, we're very limited on that.
Yeah. Is there anything that we haven't covered about Traveling Tooth Fairies that you'd like to share?
So our program is, we're providing evidence-based care, Erin. So that means we're providing, dental sealants, doing fluoride treatments, providing or applying a medication called silver diamine fluoride that stops the progression of a cavity. and also a protective restoration. So if we see a kiddo that has a tooth that's pretty bombed out, meaning a giant hole, he's getting food caught in there, we can kind of clean that area very gently and then provide a protective restoration, which will help protect that tooth until maybe this tooth comes out, or when this kid, will be able to see a dentist to have it evaluated. We also, are a liaison to provide kids or families with finding a dentist to continue care. So this program is actually, meant to complement kids receiving care with their dental provider. We're not doing cleanings. We're not doing x-rays. It's just kind of be an additional preventative services that these kids can have.
Okay, that's great. And then the last two questions I ask everybody that comes on. So the first being if you could recommend another nonprofit that we could have on the show.
Ooh, I'm going to say Bridges. Bridges in Nashua. They are a domestic violence kind of a shelter for women, for kids. So they're a great organization, and they do a lot of good things in the community. I've dropped off toothbrushes to them a couple times, and Marguerite's Place is another good one as well. So in Nashua.
All right, that sounds good. I'll look into those.
Awesome.
Thank you.
You're very welcome.
And then the last question, because since this podcast is kind of centered around promoting kindness and good things going on, is what is the kindest thing you've either witnessed or been a part of?
So the kindest thing that I've been a part of or witnessed, I feel very lucky and very fortunate, and I'm so happy, and I thank God every day for us being part of this program, and, to kind of give back. Sometimes when I'm at the grocery store, I'll pay for the person's groceries behind me, or just, I think kindness goes a long way, and just doing something good, and you can kind of start a kind of like a domino effect, and it really can be impactful or help them. So that's, one of the things that I like to do to give back, especially that it makes me feel good in a way that I know it'll come around tenfold and be, it'll continue to grow, and people will continue to do good things, especially now around the holidays too. You don't know what somebody's struggles are at home. So
I definitely agree. And I think you're doing a great kindness by having this organization for people. And as far as what else you said, I think it's true. Those little small acts that people can maybe do can have a huge impact on somebody else. Because like you said, you don't know what people are going through. And especially the holiday season, it's a very happy time for many people, but it can also be a very difficult time for people. So
for sure,
definitely spreading those little kindnesses can be a great thing. So thank you for all that you do.
Thank you so much.
And thank you for being here today. I really appreciate it. And I'm glad we were able to let people know about Traveling Tooth Fairies and all the great work you're doing.
Thank you so much. I appreciate it. Thank you.
You're welcome. I hope you enjoyed learning more about the Traveling Tooth Fairies and all the important work that they are doing in their community. As you've learned, dental health is a very important factor to your overall health, and the work that they are doing to help children who might otherwise never see a dentist, I think, is incredible. So I hope that you will check out their website. If you have the means, please donate to help them out and help them continue to do this amazing work. Thank you so much for listening. This is going to be the last regular episode of the year. I will have a very special episode for you coming on Christmas Eve. Then I'll be back with new episodes in January, so look forward to that. I hope that you all have an amazing holiday season. I hope that you enjoy this podcast, that it's brought some positivity to your life. If so, please make sure that you rate and review, and also subscribe to the podcast so that you never miss an episode. Follow Dose of Good Podcast on Instagram and Facebook for all the latest information about the podcast. Forgive me for not sounding my best on a number of these episodes. I seem to catch a cold every other week since my son has been in daycare, but I power through and do my best, and hopefully it comes across okay for you. Stay tuned for that special episode, and I'll be back with brand new episodes in January.